Our focus was on North Carolina's Healthy Opportunities pilot program, and we were fortunate in that CMS granted an 1115 waiver about 4 years ago. I think it was first of its kind waiver focused on social determinants of health. And so our discussion today was how that program is going and lessons learned, as well as the impact that program has had over the last 2 years. I think a couple of lessons learned. One is the importance of collaboration and communication in planning a program as big as this is and bringing together the stakeholders from the entire large health ecosystem to really plan and to execute on the program. And I think first of its kind program, but many of the stakeholders that are involved now had never really worked together before. So really important in the success of it to bring everyone together and to continue that communication. I think secondly is the impact of the program over these first 2 years. And I think, initially, there was a real intense focus on what is the cost savings, right? The dollars and cents savings as a result of this program, which there are, right? I think we're 18 months into the program, and certainly a reduction in utilization, ER visits, admits. But I think the value of it is so much bigger than that. We think about the positive impact on a community and the ability for community-based and faith-based organizations to be a part of the healthcare solution, the healthcare environment. We've been able to see workforce development improvements. We've been able to see CBOs now really build infrastructure to be able to meet the needs of the community. And I think the other value in real learning is the impact on consumers. And not only are they living a better health from a physical standpoint, but their emotional health and their behavioral health. And just being able to feel like they're a thriving, contributing citizen of their community. There are no dollars and cents you can attach to that value. I think there are a number of metrics, and I think the easiest metrics to go to are more of the what I'd call medical utilization metrics. So reductions in ER visits, reductions in admissions. But I think the other thing is the contribution or the impact that it has on the consumer, right? Their behavioral health improvements, their ability now to be able to go out into the workforce, right, and to be able to get a job, an important metric. And then I think the other is around the community metrics and really being able to look at the sustainability of community-based organizations, their ability to be able to grow, their ability to increase capacity to meet the needs of their growing, thriving community. Metrics are always important. You got to be able to measure to know what the impact is. And Unite Us has really helped us in a lot of different ways. One is being able to track referrals coming in and then ensuring that those referrals get closed out. That's most important. And we've not really been able to do that effectively without a platform like Unite Us. I think secondly is the ability to be able to track capacity. We know that there's now increasing demand and increased need for these social requests, so transportation, food, and it's important for us to be able to track to know what services are being provided, but then also where there might be capacity gaps so that we can quickly, working together within the community, be able to address those gaps and to make sure that they're met on a go-forward basis. I think one of the biggest challenges, again, is that we've got many diverse stakeholders, right, that have never worked together before that are now coming together. And I think data in the being able to share the same data and to integrate that data is critically important. And so Unite Us has been able, through the use of its platform, be able to house all that data for each of the individuals within the ecosystem to be able to see it. So we've got physicians, we've got hospitals, community-based organizations, payers, now able to see the same data and to be able to manage from that consistent database. Alignment is really important, right? And in order to get alignment, you've got to be able to use the same data and have an understanding of that data.